Do you know how essential is iron for your health? Iron is an essential mineral that plays a critical role in the growth and development of elders and children both. Iron is necessary for the formation of hemoglobin, a protein found in red blood cells that carries oxygen throughout the body. Iron is also important for brain development and function, immune system function, and energy metabolism. Iron deficiency is common in children, especially in those under the age of 2 and in those who follow a vegetarian or vegan diet. Iron deficiency can lead to anemia, which can cause fatigue, weakness, and poor immune function. Severe iron deficiency can also lead to developmental delays and cognitive impairment. To ensure that kids get enough iron, it's important to include iron-rich foods in their diets, such as lean meats, poultry, fish, beans, lentils, tofu, fortified cereals, and leafy green vegetables. For infants, breast milk or iron-fortified formula is recommended, and for older children, it may be necessary to supplement their diet with iron supplements, especially if they are at risk of iron deficiency. However, it's important to talk to a healthcare provider before giving children any supplements. Iron can be found in a variety of foods, both animal and plant-based. Here are some common sources of iron. Red meat. Beef and lamb are rich sources of iron. A 3-ounce serving of beef contains about 2.1 milligrams of iron. Poultry. Chicken and turkey are also good sources of iron. A 3-ounce serving of chicken contains about 0.9 milligrams of iron. Fish and seafood. Oysters, clams, and sardines are particularly high in iron. A 3-ounce serving of oysters contains about 8 milligrams of iron. Beans and lentils. Kidney beans, black beans, chickpeas, and lentils are all good sources of iron. A cup of cooked lentils contains about 6.6 milligrams of iron. Tofu. Tofu is a good source of iron, particularly if it has been made with iron-rich coagulants. A 3-ounce serving of tofu contains about 2.7 milligrams of iron. Fortified cereals. Many breakfast cereals are fortified with iron. Check the nutrition label to see how much iron is in a serving. Leafy green vegetables. Spinach, kale, and other leafy greens contain iron. A cup of cooked spinach contains about 6.4 milligrams of iron. Nuts and seeds. Pumpkin seeds, cashews, and almonds are all good sources of iron. It's important to note that the type of iron found in animal-based sources, heme iron, is more easily absorbed by the body than the type of iron found in plant-based sources, non-heme iron. Therefore, vegetarians and vegans may need to consume more iron to meet their needs. Additionally, consuming foods rich in vitamin C, such as citrus fruits, strawberries, and bell peppers, alongside iron-rich foods can help improve iron absorption. Iron absorption can be affected by several factors, which can either enhance or inhibit the absorption of iron in the body. Here are some factors that can decrease iron absorption. Phytates. Found in legumes, whole grains, nuts, and seeds, phytates can bind to iron and reduce its absorption. Calcium. Calcium can reduce the absorption of both heme and non-heme iron if consumed together. Tannins. Found in tea, coffee, and red wine, tannins can inhibit the absorption of non-heme iron. Polyphenols. Found in certain fruits and vegetables, polyphenols can bind to iron and reduce its absorption. Medications. Certain medications, such as antacids, proton pump inhibitors, and antibiotics, can reduce the absorption of iron. Iron overload. If the body has too much iron, it may not absorb additional iron from the diet. Inflammatory bowel disease. Inflammatory bowel disease, such as Crohn's disease or ulcerative colitis, can impair the absorption of iron. It's important to note that while certain factors can decrease iron absorption, consuming vitamin C alongside iron-rich foods or supplements can enhance iron absorption. Additionally, cooking iron-rich foods in cast iron pans can increase the iron content of the food.